I'm going to be talking with you today about biomechanics for kayaking. That sounds kind of dry. Basically, what I want to convey to you, I should probably just say, if you don't know, I'm a chiropractor and a massage therapist, and I teach yoga, and I've taught anatomy for about 35 years. And I've been doing this presentation for BASK for a long, long time, with the exception of last year. And some years ago, I was a coordinator for the clinic. So I congratulate you all, and it's going to be a great experience for everybody, I'm sure. And I'm really happy to be able to be back to this year to share with you some of my favorite stuff about. Yes.
This year's coordinators are graduates of your
So it's my fault. No. Despite. Okay. So first and foremost, we talk about your shirt, your T-shirts say something about teaching something to do about kayaking safety, right, for many years. So the first most important thing to convey is how to do this safely, okay? How to do kayaking safely. And it's not only about the kayaking, it's about getting the boats from where you store them onto your car, onto the beach, right? I was delighted to find a couple weeks ago paddling with someone that there was some higher up within the kayaking community made a great case for the importance of helping one another with boats, okay? A kayak is a big thing. Even if you've got a little surf boat, it's large. They weigh a lot, especially if you've got the plastic boat where you can bang around in the rocks without destroying your boat. They're heavy, they're cumbersome. Help one another, okay? I know that BASK is a culture of that, but I just want to reinforce that, be safe not only on the water, but getting there and getting off, okay? And this can be particularly challenging. Jonathan just talked with you about navigation. You'll be learning more stuff about expeditions today. Penny talked with you about expeditions yesterday. When you're trying to move a fully loaded boat, it's really essential, right? So anyway, but again, not only on the water, but getting there and getting to and from. We want to so beyond safety, we want to optimize. We want to optimize strength, flexibility, to be able to optimize our paddling while we're on the water, okay? And one way of doing that is keeping the joints in as a home base in a neutral position, right? I mean, you know the importance, I'm sure you all already know the importance of spinal rotation, because you spin from the spine optimally when you're using your paddle. If you're using your shoulders, if you're using your arms are going to get tired, your shoulders are going to get tired, they're much more likely to be injured, okay? So when I talk about the neutral position, okay, everyone has their own ideas about what are best stretches and what are muscles that are most important. So despite some of what may be controversies, I will implore you to try to stay neutral and try to stay balanced. Okay, so I mean that in a few meanings of the word. So when I talk about a neutral position, it's kind of the home base for the joints or collections of joints in the body, right? So, for example, for the wrist, right? Can I borrow your paddle? Since it's just right up here. Oh, this is lovely. Okay. This is what is this position? What do you know about this? Low brace. Okay. Can you see the position of my wrists? Okay, so paddle blade aside. Okay, so this is what we refer to as the neutral position. Can you see how this is different than this? okay? Or then this, okay? So with the wrist in neutral, easiest enough for me to demonstrate to with paddle in hand. Without paddle in hand, if this is the neutral position and you are paddling in significant wind, what's going to happen? The paddle is going to get hit by the wind and it's going to push the wrist into this position. You can see that's not the neutral position, okay? So particularly in conditions in high wind conditions with with Euro blades, that becomes especially important. That's part of why the Greenland paddles were designed, and I'm sure most of you probably seen a Greenland paddle has a really, really long, I mean, this is sort of a modification because it's a really long paddle, a little bit smaller face, because with less face, there's less wind resistance. So Greenland paddles are designed to be used most beneficially in places where there's lots of wind, okay? They also make really great things to see beautiful bioluminescence when you're paddling. So when you do your last weekend, you'll get to draw in the water. Okay, so that's the neutral position with the paddle in hand. What's the neutral position look like without paddle in hand? I'm going to turn around so you can see more easily my hands. So if you draw a line with your palms facing one another, okay? If you were to draw a line down the forearm and through the thumb, that's the neutral position. So you can see most of my hands a little bit behind, okay? But that's your neutral position, okay? So that's not to say that you never move out of that position, but that ought to be your home base, okay? And of course, you don't have to do the death grip on the paddle, because that's a lot of wasted energy. And if what we want to do is maximize our, our power, our energy, you don't need to waste a lot of energy. The other thing that gripping the paddle does is what? It makes it less easy to move, and again, your wrist is going to be more apt to injury if you come out of that neutral position. Okay, so that's the neutral position of the wrist, and we'll talk more about that later. Neutral position of the spine, head on top of shoulders, on top of pelvis, okay? So let me have everybody stand up, if you will. And what we're going to do is I'm going to ask you to go find a wall at which you can stand. Sorry, Jonathan, I didn't give you a heads up on this. So find a wall. Bring your feet about 6 inches away from the wall so you can let your butt go to the wall. The windows won't work because you need to actually have wall behind you. You can use the doors work. And actually, you come on over here because there's way more space for one person, okay? Yeah, and that's great. You can use the post, okay? So if your heels, we all have back sides, right? So let your heels be a few inches away from the wall. Let your bottom go to the wall. Let your shoulders go to the wall, okay? Let your head go to the wall. Does your head go to the wall? I'm going to be running around here now, okay? So some of you may feel like, wow, I'm leaning backwards. Let me have you drop your chin just a smidge. Yeah, that's it, all right? So if you can have your shoulders to the wall and your butt to the wall, okay, now what we don't need to do is bring the arms to the wall, okay? Because if you're, Huesudo here will demonstrate that, because as you can see, his arms hanging down, his arms are not along his back, right? So the shoulders actually rest, okay? We talk about anatomical position being like this, okay? Well, the natural position of the body is to have the thumbs pointing forward, okay? I think anatomical position was designed so that anatomists could separate out. Huesudo has one fully functioning arm. There's 2 bones in the forearm, okay? And this is the natural position of our bodies, right, with the thumbs pointing forward. But if you were trying to take a picture of the bones, you wouldn't see the whole thing. But this anatomical position begins to help us to restore the neutral position of the shoulder blades. Okay, so that's another thing we want to keep in neutral. Most of us during the course of the day spend time doing what? On computers, on our cell phones, driving, right? So what happens? We tend to move out of the neutral position. The shoulders roll up, the shoulders roll forward, okay? So over time, the front body gets shorter, the back body gets bigger. Where's the discomfort when you've been sitting at your computer for, right? Right here, between the shoulder blades at the top. That's because those muscles are being overstretched and they're working too hard. Okay, so what we want to do is we want to try to restore balance. Okay, so I got you all against the wall. So once again, now let your knees just relax a little bit, because if the knees lock, then what that tends to do is to tilt the pelvis forward. So if you can just let your knees relax a little bit, and then drop your tailbone ever so slightly, so you feel a little bit of extra space at the low back. Okay. All right. So then we're going to roll the arms open from the upper arm. Okay. So the result is that the hands are going to come out to the side. Okay. Can you feel how that opens up the front of the chest? Great. Okay. Now, if it's available for you, so again, from the upper arm, because you can, if I twist my hand around, you can see I can still have my shoulders rounded, so I'm not really opening that up. So let the shoulders slide down your back. Okay. Tuck your chin just a little bit, because when we do this rounding forward and then you have to look where you're going, can you see how that compresses the back of your neck? You don't want to do that, right? That's not going to be helpful. So let the shoulders slide down. Lift just a little bit at the sternum. Drop your chin so you get that same length at the low back. You get the same little bit of length at the back of the neck. And then roll the arms open so that the thumbs come out to the side, and then roll. Can you feel that opening up the front of your chest? Yeah, good, okay. So yeah, you can keep rolling that over. So yeah, but you're against the wall, great. Rolling open, that's it. And at some point, maybe your thumbs will touch the wall, yeah, okay? So, now if you're at the windows, you're not gonna get the benefit of that thing. All right, so this is a mobilization that you can do. Slide the arms just about halfway up. Can you feel how that stretches out your chest? Front of the chest? Yes? Okay. And come on back down. Okay, come on back to your seat. Thank you. So, that's again a demonstration of.
That was not neutral though, right?
Oh, yes.
That's neutral.
Yes, it is neutral. Okay. That's a really good question, right?
Not feel neutral.
That's right. That's right. Okay. And that's why, I'm talking with you about the importance of, helping to restore the balance so you get closer to neutral, because when your muscles are in balance, where the back muscles and the front muscles are the same length, then you're going to be stronger. A long muscle is a strong muscle. When the pecs are tight and short, right, and you're trying to paddle, you're going to hurt back here, you're going to hurt up here. This is tight and short, so stretching is an important part of restoring balance and increasing strength, okay? A long muscle is a strong muscle. I love that aphorism, okay? So if something is short and tight, it's gonna be weak. So one of the important components, and that's certainly not the only thing, but one of the important components of optimizing your strength, your endurance in paddling is maintaining increasing muscular balance, okay? If the muscles are the same length, then that neutral wrist, neutral spine, neutral cervical spine, the neck, is going to be a whole lot easier to achieve, okay? So we want to try to return to neutral, try to restore and increase the balance of our bodies, okay? Again, spine, head over shoulders, over pelvis, the wrist in neutral, the shoulders in neutral. So you can see all of that just by standing up against the wall. Okay. So now I have to put my glasses on because I can't read my notes. Okay. So right, there are tendencies that we all have. Some muscles have a tendency to get too short and tight. Other muscles have a tendency to get weak. Okay. So this is not rocket science, right? What muscles? Somebody show me where do you get tight? Where's the place that gets tight? Right up here. Okay. So what's going on here? We have muscles, a couple of really important muscles that attach from the shoulder blade. One of those muscles is called the levator scapula. Can you imagine what that muscle does? Levator scapula, right? Muscles are named for what they do or what they look like, right? They're these funny Latin names. Levator scapula, right? That was the joke when I would teach anatomy. What does it do? I don't know, right? Right? So, okay. So that leads us to leads me to a very important point. Again, certain muscles get too tight, other muscles don't work as much. So you can bring the shoulders up, that's called elevation. You can bring the shoulders down, that's called depression. So everybody, lift your shoulders. Easy to do, right? Your body knows how to do that one, okay? Let the shoulders drop. Now, can you draw your shoulders down your back? Not back, okay? Right? Because the opposite of up is not back. Right? The opposite of up is down. Okay? Can somebody come up and help me with this one? A simple little. Thank you, Tom. Come on up. So Tom's gonna be my most able assistant here, and I'm gonna put my hands on his. Oh, he knows he's done this before. Okay. So I'm just gonna provide a platform for his forearms. So as he elevates his shoulders, you see his forearms go away. So lift your shoulders up. His forearms go away from my hand, and let your shoulders drop. Okay, now without changing the angle of the elbow, because you didn't change the angle of the elbow before, without changing the angle of the elbow, will you press? Yeah, can you see that? Everybody see? Okay. His forearms pressed into my hand. So what muscle was he contracting? Let's have you turn around. Okay. There's a very potentially powerful muscle that draws the shoulder blade down the back, and when he does that, when he draws his shoulder blades down, this engages, okay? So let's have you all do, oh yeah, and then one more thing. So there's two muscles, so let's have you come over this way. Thank you. Okay, so there's one muscle that attaches from the shoulder blade that comes over and attaches. See these little red dots? That's the bottom attachment of the muscle. So it comes on the shoulder blade. It comes. If we could peel back the shoulder blade, it goes under the shoulder blade and comes and grips at the nipple line. That's why I chose a man to help me with this one, because the muscle attaches right there. Okay. There's another muscle. Anybody ever hear of the latissimus dorsi? Okay, the lats, okay. Anybody a swimmer? The breaststroke, right? That is a stroke that makes for the powerful V shape in swimmers, okay. So that muscle actually attaches in the front of the upper arm bone. So the stroke this is the longest place of the muscle, and that's the shortest place of the muscle. Okay, so we're going to modify what I'm going to ask you to do one more time. Let your elbows bend. And now take your elbows out away from there you go. And then once again, press your elbows down. Yeah. Okay, so he's not pulling his arms in. Thank you very much. Okay, so he's not pulling his elbows in. He's drawing his shoulders down. Okay, doesn't have anything to do with the forearms. So you can all do this as you're sitting. Okay, let your arms be by your sides. You don't have arms on the chair, so you can do that. Okay, so try to have your head on top of your shoulders, on top of your pelvis as you're sitting. Right. Again, it might feel like it's a little bit awkward. This is something that I suggest to my patients, that wall stance, just to get up every once in a while and go stand at the wall, because you'll realize, wow, that feels less like I'm leaning back. It doesn't feel like I'm in a neutral position. Okay, so try to find that upright, and it's relatively easy to do when you're sitting. Lift your shoulders. Bring your arms a little bit out to the side. Draw the shoulders straight down. Okay, can you feel that? Okay, if you bring your own hand in your armpit and draw down, you can feel right along the inside of your rib cage. That's the muscle. It's called the serratus anterior. So if you go work out at the gym, next time you're at the gym, you can do wall push-ups to add strength to that muscle if you so desire. Okay, because that's part of what the muscle does, and I can show you what that looks like. You let the shoulder blades go away from the torso, and then you draw the shoulder blades down and draw the shoulder blades in toward the torso. So that's a wall push-up.
You're keeping your elbows in, you're not doing
Yeah. Well, because if you want to keep the shoulder blades in neutral, what happens if the elbows go out to the side? The shoulders roll up, typically. They don't need to, but they tend to do that. Okay. So again, muscular balance. So we know that this one has a tendency to get short and tight. Okay. And then these muscles are probably muscles that are not really strong for most of us. So every time, and this is another concept you may or may not know, every time we contract a muscle that does the opposite thing, the antagonist to that muscle, actually gets a message from the brain that says, let go. Okay? You can't contract, for example, you can't contract your bicep and your tricep at the same time. Right? You contract your bicep, what happens to your tricep? Right? My mother used to say, women of a certain age, right? Because we're doing this all the time, right? When we're driving, when we're at computers, when we're eating, when we're drinking. You know, the biceps don't need to be strengthened for optimal balance of the body. You want to strengthen the triceps because every time you contract the biceps, the triceps is getting an inhibitory message. It's getting a message from the brain that says, let go. So if you want to restore balance, right, you want to strengthen the muscle that has a tendency to be unused, okay, and often lengthen the muscle that has a tendency to become tight and short. Which reminds me, on the BASK website, if you go to, oh my goodness, now I can't remember, articles, miscellaneous articles. There is a whole bunch of photographs there, which is from the 2002. So way back in this, I don't have hardly any gray in those pictures. Lots and lots of photos of different stretches that you can do. And if I'm lucky and you folks have provided the time, I will be with you for just a couple minutes next weekend, first thing in the morning, to take you through some of those things. So if you have an opportunity to check it out, okay? Now, the next thing I want to say about that is, I've been talking about stretching. I talk a lot about stretching because it's really important in terms of restoring balance, increasing balance from certain muscles to other muscles, to stretch the muscles that are tight and short. Because if you want to increase your strength, right? Let's say I want bigger pecs. I want to work on my pecs, right? So we must. Well, these muscles have a tendency to get too short, right? You all had that firsthand experience because when you did that, which was actually the body in balance, it felt really tight here. So these muscles are already, for most of us, tight and short. So if you want to strengthen a muscle that's already tight and short, what are you going to do? You're going to increase the imbalance. Okay? So, and if you want to restore the balance of a muscle that's really short and a muscle that's cranky because it's being too often used, right? I know sometimes what gets recommended to people to help their posture is to strengthen the muscles that pull the shoulders back, okay? The muscles that pull the shoulders back are working all the time. They're trying to restore the balance to your shoulders, but they can't do it because these are too short. So part of the reason that they hurt, part of the reason that these are tight is because they're working all the time. It's like, come on, give us a break. So give them a break by engaging the opposite muscle, okay? And the best way to help restore the balance, again, my bias, is by stretching. Because if you're trying to strengthen this, but this is really, really short, you're not even going to get the shoulder blades. They're not even going to go back very far because this is so short. So you stretch the ones that are too short, and then you can optimally strengthen the ones that are weaker, okay? But if it's so short, if this is so short that you can't even get those shoulder blades back, and they're already working too hard, give them a break, okay? So a couple things about restoring balance, right? And is this related to kayaking? Absolutely, right? Because you're going to be using those muscles, okay? So if your steady state for your shoulder blades is with your shoulders drawn down your back and your shoulders in a neutral position, you're going to be able to use both the pecs and the muscles in the back to facilitate the movement, which of course is being initiated from the spine, okay? But you want to have the shoulders balanced, especially again if it's a windy day. Not only are the wrists going to go backwards, but you're going to be coming like this because you want to have a smaller profile against the wind. And as soon as you bring your shoulders forward, they roll up. This is where it's going to hurt. So even if you want to lower your profile in your boat, you can still keep your shoulders drawn down your back, right? And come forward from your hips. So your head can still be on top of your shoulders as you're paddling, okay? So now I want to draw a distinction between what many people call stretching and what I call stretching. And for this, Jim was kind enough to send me information that was put someplace about the truth about stretching. So you may find this, I don't know if it's on the website or if it's in the student section. Okay. So it's an article on stretching, and it comes from some kind of sports magazine. Well, my first cue that it might not be the optimal information for you is because nobody laid claim to it. There wasn't a name attached. Okay? So, which doesn't mean it's bad, and it's not bad information. There's some really good information, okay? But I want to give you the scientific data about distinction between static stretching and what's referred to in the article as dynamic stretching, which is what I refer to as mobilization, okay? So, static stretching, that's when you, okay, let's all do a static stretch. So you know how to draw the shoulder blades down your back, okay? So just a little bit of draw the shoulder blades down the back. So what that does, it gives that levator just a little bit of stretch. So don't pull too hard, okay? Just engage this muscle here. So now you've lengthened this one. So levator scapula attaches from the superior angle of the scapula and goes up to every single vertebra in your neck, okay? So with the shoulder blade engaged, just let your head release, let your ear, your right ear, drop down toward your right shoulder with your nose continuing to face forward. Just easy, don't pull, just drop. Can you all feel the stretch over here? Okay, so that's a stretch. Now, if your head is dropping forward, then you're getting a little bit of stretch in the back, and that's okay too, but for the purposes of my illustration. And if your chin is sticking up in the air, then you're compressing the back of your neck, so kind of tuck your chin just a little bit, But again, you want to have and hang out there, and hang out there, and hang out there. And if it already hurts, then lighten up, okay, and hang out. And hang out, because there's nobody here who's less than 30 years old, okay? Now, easily and gently let your head roll to the center and pick it up. So my point in saying that was, there have been a number of studies that have been done over the last decade which have demonstrated that if you want a static stretch to be effective, to actually lengthen the muscle fibers. Muscle fibers are made by two proteins that overlap and lock, and so if the space between, if my fingers represent the proteins, we overlap and lock, and the ends of my fingers represent the end of the functional muscle fiber. When a muscle gets tight, it gets short. Okay, so now it's really obvious. If I want to contract that muscle, it's not going to go very far, so it's not going to be very powerful. Okay, if I overstretch the muscle, that's what a muscle tear is. Okay, but your optimal muscle length, okay, there's a little bit of overlap, but not a lot. If it's tight and short, if you want to lengthen that muscle fiber, okay, there's, again, at least half a dozen studies that were done in the last decade. I've boiled it down to, well, they did a study with 15-year-old soccer players, and 15 seconds was what they needed for a stretch for the muscle fibers. And then they did another study with a bunch of graduate students, 20 to 30 years old, 20 to 30 seconds of a passive stretch to lengthen the muscle fibers. So then they did another study with the principal investigators of various things. And so you can imagine the PIs are a little bit older than some of the other folks. And so my shorthand rule of thumb is, if you want a passive stretch to be effective, you need to hold that stretch for as many seconds as you have years of your life. Okay? If you hold the stretch for 15 or 20 seconds, you go, God, I can't stand it. Back off a little bit. Okay, so don't stretch too vigorously, otherwise what happens is that the muscles actually tighten up, okay? I don't know if you've ever gotten a massage. I've taught massage for years and years and years and years, right? You go and get a massage, and they're moving into those muscles so deeply, you can't stand it, right? It's the same thing. Too much stretch. The body responds by a reactive cramping. It actually tightens up. So lighten up, right? Yes, Mark?
When you feel like a knot in a muscle, is that those muscle fibers? Like
Correct,
that,
correct,
short?
correct, correct. Okay, so again, these guys get tight in the back. It's the muscles in back here. There's muscles that bring the shoulder blades toward the spine. There's also muscles, see all these little red and blue dots along the spine? When your head's in front of your shoulders, the muscles that go up to the skull and to the upper cervical area, the other attachment of those paraspinal muscles is right between your shoulder blades. So it may well be that the knot that you feel back here is because these muscles over here, these muscle fibers over here, are overstretched. They're working really hard. They need a break. It may feel like, oh yeah, that's what I need. Well, that'll give you symptomatic relief for about as many seconds as you do it, and maybe as many seconds thereafter, but you're overstretching something that's already overstretched and working hard. Or you open up the front of the chest, you restore balance, okay, so that your head is on top of your shoulders, and then they won't get aggravated and annoyed and make noise, okay? So that's my point with that. Okay, now I sort of lost my train of thought. So we talked a lot about neck, shoulders in neutral, neck in neutral. We're spending a lot of time in what position in our boats? In a seated position, okay? Wayne and I were talking about this before class. How many of you spend more time running or walking up hills than you do sitting? Okay, so my point being, okay, when you're in a seated position, now when you're in a seated position and your feet are flat on the floor and you're using the backrest, there's minimal action that's happening because the chair is supporting you, okay? But how many of us sit like that, right? We tuck our feet underneath us, we cross one leg, you're at the keyboard. If you look at the way automobiles are designed, seat pan, seat back, headrest, you can't have your head on top of your shoulders. This is done because auto manufacturers understand that when you get into an accident, if your head is in front of your shoulders, that's why you get a whiplash. because you get bumped in, the car stops, your head goes whomp, and then it goes whomp because the muscles in the front of the neck want to help to minimize the force that way, and that's what a whiplash is. I can tell you from firsthand experience because I need to walk my talk. So my head is on top of my shoulders. My head is at my headrest when I'm in my car. And I got into a fender bender, and I had absolutely no neck pain. My head was at the headrest. So there wasn't a boom, boom, back and forth. Okay? So, but we're in a seated position. So, Seymour here has some red tape to demonstrate the attachment of the muscles. Okay, the red tape represents the muscles that are the hip flexor muscles. So this is a muscle called psoas, joined up with another muscle on the inside of the pelvic brim called the iliacus. Okay, iliopsoas. The other attachment of the muscle is this blue dot, okay, high up on the femur. So what does that muscle do? If we contract the muscle, it brings the knee up, right? So that action is called hip flexion. Opposite action is called hip extension. Okay? So when we're sitting, this muscle is contracting, especially when you're in a kite. Maybe you have a little bit of a backrest, but you're right. So that iliopsoas is contracting. Okay? And especially if you're using your hips as you ought optimally, again, to maximize, so it's not right, you're not using your arms. You get the shoulder blades attached to the torso, and that facilitates that torso rotation, right? And then you move your feet and your hips, you press into the foot pegs and slide your butt back and forth. You're using those hip flexors, okay? So how would you then, if you wanted to restore the balance to the hip flexors that get too tight, what would you do? The opposite action, you do hip extension, right? But when you're sitting in your boat, right, you can't do this, right? Or do a lunge. You can do that when you get out of the boat, okay? But you can't do it while you're in your boat. But what can you do? The same thing that you can do while you're all sitting right here. Put your feet flat to the floor, if you will. Put your feet flat on the floor. Bend your knees to 90 degrees. Yeah, okay, now it's not exactly like being in your boat, but as you're there, can you feel where your sit bones are in your chair? Okay, so if you can tuck your tailbone under you, okay, so you bring your pubic bone forward a little bit, you'll feel your low back stretch a little bit. Can you all feel that? Okay, how'd you get there? The lower abdominal muscles, which, by the way, are muscles that have a tendency to get too weak. It's not a problem to work on strengthening those, okay? Little bit of stretch in the low back, right? Most of us have low back discomfort, and often it's because of this muscle, because when it gets short, what happens? And what do we feel? We feel pain in the low back, but what's the problem? The muscle in the front of the lumbar spine. When you tuck your tailbone under, you engage your abdominal muscles, the low back muscles release. You're also squeezing your butt a little bit. Can you feel that? Okay, and then let that go. And I can tell you're doing it right because your heads are bobbing up and down. Because when you contract those gluteal muscles, right, the muscle gets shorter and tighter. Right? So it gets a little bit shorter, so you come up a little bit. So you can do that when you're in your kayak. Okay? You can do that tailbone tuck even when you're in your boat. Every time you contract the hip extensor, the hip flexor gets a message from the brain that says, let go. Okay? I know I only have just a couple minutes left, but again, I want to draw a distinction between stretching as many seconds as you have years of your life. If you're doing static stretching, there is something that in this article is called dynamic stretching. I would refer to that as mobilizing. Okay? Because mobilizing or dynamic stretching will help you to use your body, the available range of motion of your muscles optimally. And that's what you want to do before you paddle. Okay? If you stretch, and this is one of the points that is absolutely accurate in that article, if you fully stretch a muscle before you exercise, it actually becomes functionally weak. You don't want to do that. You want to stretch when you get out of your boat, after you paddle, and those muscles are tight and short. That's when you stretch. Before you get in your boat is when you want to mobilize. Okay? Let me just make sure that I have. All right, so the muscles that will be helpful to be mobilized, most especially before you paddle, okay? The spinal twists, and we're going to do that in just a minute. Shoulders, roll the shoulders, okay? And if we know that our shoulders have a tendency to do this, if we're going to mobilize the shoulders, we want to go up and back and down because we want to get them juiced up a little bit. Can you feel that? It feels great. If you come forward, you're reinforcing this. So you want to kind of roll back, shoulder range of motion, okay? Hip range of motion, I showed you how you can do a little bit of that pelvic tilt. You can take the pelvis in all different directions. And Wayne, if you take the pelvis in all different directions, you're contracting one side of the quadratus lumborum, and then you're stretching the hip flexors, contracting the hip extensors, then you're contracting the other side of quadratus lumborum, and then, right? So if you make circles, so you're just, as you're sitting, you can do this as you're sitting in your boat, right? You're paddling really fast and you're waiting for, before you make the crossing, you're waiting for other folks in your boat, okay?
Or the airline seat.
Or the airline seat, exactly, okay? The QL is very important for when you want to, what's this called? Well, hip snap, yeah, ooh, that can be treacherous for the QL, the hip snap, because that's how you get this one cramped, okay? But right, if you do this in your boat, what are you doing? That's a lean, okay? See, my pelvis is going one way, my shoulders are going the opposite way, that's a lean. And what's this? That's that's edging, that's called edging, okay? So you're keeping your boat upright, and you're taking your upper body over, okay? So we have an edge, and then we have a lean, so that's why this is a good thing to do as well, okay? So that's the mobilization. Wrist range of motion, I'm going to have to show you this over the weekend because it's a little complex. It has a few details, but I will definitely do that, okay? Mobilize before, stretch afterwards. Let's do a mobilization for the spine now. You all brought your paddles in, so I want to have you be able to use them. So we need to spread ourselves around in the room. Okay, so I have this imaginary paddle. So bring your arms up, and can you, okay, so let your hands be straight up from your elbows. Okay, that's it, good, okay. Bring your hands a little bit wider. That's the way, and that'll actually be easier, okay? So if your arms are at 90 degrees, if your arms come straight out from your shoulders, can you do that? Yeah, and bring your hands a little bit wider, good, because that's going to make it easier for you to, okay? So your paddle should be about at the level of your head now. Now, could you, yeah, so the crown of your head, sorry, I should have brought my paddle, okay? So if it's above your head, okay, can you imagine taking the paddle a little bit further back? Are you getting a stretch for your pecs? So now we're getting a stretch, right? This is not neutral. Now we're getting a stretch for the pecs. Can you slide that paddle down behind your head? Just let's take it behind your head, just behind your head, is what that's going to do, right? And then press your head back into your paddle a little bit and let your shoulder blades drop. Yeah. Okay, how's that feel? Everybody doing okay? In this position, okay, let me straighten you out. I'm a stickler for balance here. And let's get your wrists in. Yeah, and a neutral. Bring your hands just, there you go. There's your more neutral position. Okay, great. Let your shoulders drop. That's it. Everybody bend your knees a little bit and just tuck your tailbone just a little bit. Yeah, just a little bit so you get a little bit of length in your low back. Look forward. If you look to the floor, what are you going to do? You're going to fall down. Okay, take a breath in. As you exhale, turn to the right. As you inhale, come on back to center. As you exhale, turn to the left. Really use your breath. Inhale, center. Exhale. Inhale, come up. You can let your pelvis turn a little bit as well. Exhale into the turn. Inhale out of it. Exhale into the turn. Inhale out of it. Try to keep your head on top of your shoulders. Great. Okay. And lift the paddle up. And bring the paddle forward. And thank you. So I will see you on next weekend, and we'll do some more mobilizing on the beach. One final thing to say, all of those pictures that are on the website are demonstration of what are the positions for stretch. If you come into the position and go out of the position, then it becomes a mobilization, okay? Can I borrow your paddle for just a second? Okay, so if I'm doing, okay, this was the sort of the next phase of that. So I had you all do this. So if you can let the paddle come down, then you get even more of a, okay? So if that's available for you, then you just let your hands open up on the paddle. So if I go like that, exhale, inhale, I'm doing the same thing. It's a little bit more of a stretch than what you saw before. And if I, from the center position, if I go to the side, drop my shoulders, drop my chin a little bit, look with my eyes, and hang out here, 1001, 1002, 1003, 1004, 1005, 1006, right? As many seconds as you have years of your life, come on back to center. When you get to as many seconds as you have years of your life, that's your stretch, okay? So you can use exactly the same end position for the stretch that is the end position that you go to, or some variant of it, right? Because you're gonna, right? To create for yourself a mobilization from the stretch positions that you see in the on the website. Thank you.
Is it normal for your hands to tingle while you do that?
Oh, thank you so much for that question.
Yeah.
If your hands are tingling, you're going a little too far, okay? Because the structures here, when you stretch them, okay, they go over both the nerves that come from the neck and the blood that comes out of your heart that goes into the upper extremity. So they both pass through this area here. And if this is tighter and shorter, when you do that, if you hold that and your fingers get numb, it's either blood vessels or nerves that are getting a little compressed. So just back off a little bit, okay?
And over time it should stop.
And over time, yeah, but it's not injurious at the moment, but you don't want to stay there because there's no purpose to cutting off the blood flow, nerve flow into your hands. But know that that's okay. That's my limit. So so I'm going to back off so that I can feel the stretch, but it's not going to cause that numbness. Thank you very much for bringing that up. Okay. Any other questions? Okay. I think you should be on to what's next already. Thank you very much for your attention. I'll see you next weekend.